Hello, everyone. This is Dr. Darshan Shah, your host of the Next Health Forefront podcast. And today's guest is Dr. Amir Vokshoor. We are going to be talking about everything brain health with Dr. Vokshoor today. He is a board-certified brain surgeon who specializes in the minimally invasive treatment of brain tumors and other brain surgeries and spinal surgeries as well. He quickly realized that what he was doing in surgery did not really address the entire patient as a whole when he first started his career in surgery, and he immediately began a more integrative approach to brain surgery, which is what we're going to be talking about today. He talks about the relationship of overall brain health to surgical outcome, and he has used all that knowledge to create the Neurovella Medical Spa, which is an incredible brain spa here in Santa Monica, and also the Institute of Neuro Innovation. The whole purpose behind the Institute of Neuro Innovation is that by understanding the role of brain health and overall wellness, this organization seeks to serve people who have all sorts of cognitive decline, such as mild cognitive impairment or dementia, even leading up to Alzheimer's, who want to optimize their brain health and neurological wellness. So Dr. Vokshoor trained at the Medical College of Virginia, was where he started his career. He then moved on to Ohio State University, where he became a brain surgeon. And then he went on to further fellowship training in spine surgery as well. He's currently doing surgery as well as running the Neurovella Medical Spa and INI, the Institute of Neuro Innovation. In 2002, he was actually the chief of neurosurgery at Kaiser Medical Center. Currently has his own practice here in Los Angeles in the Santa Monica area. He's at the Disc Spine and Sports Center, and we're very lucky to have him on this show. He is a brain surgeon that has done a deep dive into everything about brain health. He's going to tell us everything that he's learned. So let's get started with Dr. Vokshoor. Dr. Vokshoor, how are you today? You're in surgery, huh?
Good. Yes. Thank you for having me, Dr. Shah. Great to finally connect.
Yeah, thank you for taking some time in between surgeries to talk to us. I know you're super busy, and it's great to actually get an expert such as yourself on the line with us to talk about brain health and everything that you're doing around brain optimization as well. And it's great to hear from a neurosurgeon. I mean, that's amazing.
You're very kind. You've been at this for quite some time too. You know, I think this is a sign of multiple disciplines kind of converging to realize that integrative health is actually the way to go for many specialties. And we've been kind of in silos for too long, and I think our patients, our colleagues, everyone else has been kind of not getting the best of healthcare because we've been in tiny little pockets doing our own thing. And I think now is the time, with like things that you've created and things that I've been working on, we can actually join forces and not be in our own little microcosms.
Yeah, it's amazing to meet a neurosurgeon that thinks the way you do, because, you know, it's just like you're saying, we've all been doing our own thing for so long, and by working separately, I think we're actually causing patients a huge disservice because everything is so interconnected. And I love to see what you're doing with like the Institute of the INI that you've created. I want to talk about that. The Neurovella Brain Spa, that's super interesting. But before we talk about that, could you just maybe tell the audience a little bit about your journey from being a neurosurgeon into this new kind of thinking that you're doing? And you like me, we're both still practicing surgeons. We operate every week. I love operating. I'll never stop operating. But I mean, my heart is really in this integrative world, just like yours. Love to hear your story.
Yeah, I mean, I think this is like any other doctor that wants to do better. I always felt like in neurosurgery, we were fantastic technicians, and we just lacked a well-rounded care. We would take out a brain tumor, and the next visit would be, your sutures are out, best of luck. You're in some other doctor's hand. And the patient never felt like they were connected to me, even though I was emotionally, I'd spend 12 hours inside the seat of their soul. So I always felt like, we needed to do more. And that's where the idea came from. And I realized that, as surgeons, we get very good at macro technical work, but we don't necessarily know what's going on in basic science. And so without being in a university and without being in a wet lab and, having all the benefits of what the universities have, we in private practice don't have direct academic access. And now is a time where I thought, to create something where private industry and non-university based physicians, scientists, or university based ones can collaborate together in a way that it's such an open source place where they don't have to worry too much about who owns what IP and what it can be discussed about. So, some of that gets a little nuanced when you talk about high level science, because there is competition in science. And I always thought how funny, we're all trying to solve the same problem, yet we certain grant writers have to compete with other grant writers, and certain universities have to compete for the same exact goal. So I wanted to create a place where we completely have the liberty of discussing our latest findings and actually advancing the conversation of integrative health, from clinicians to scientists to holistic practitioners who've been at this on their end for thousands of years, trying to tell us that, integrative brain health has like a spiritual component. And at the sounding unnecessarily spiritual, I think our nervous system has capabilities of repair and healing and recovery that we haven't tapped into, that border on what the holistic practices have brought us. So the integration was always in my head as a resident. And, I'm sure I was, I would surprise my attending physicians by having like philosophical questions about things that we were doing to the brain. And they were always like, Vokshoor, just let's just take this tumor out. Right. I was looking for things like, where's the spark plug of the brain? Where's intention come from? Why is, how can somebody with a temporal lobe arteriovenous malformation become more religious after the blood flow is interrupted in this abnormal state? So just really interesting stuff that we see in neurosurgery, and then bringing that to health and realizing, like from the works of like Dr. Emran Mayer in UCLA, that the brain gut connection was absolutely fascinating to me. So I was very early on in realizing that the greater nervous system doesn't just reside in the brain, but the heart and the intestinal tract are filled with nervous systems of their own, and their overall both neurotransmitter production as well as electrical production in heart's case affect our overall autonomic nervous system, but also our capability to respond to certain therapies and not others. And I found that fascinating.
Yeah, so absolutely.
That's where it started. And then as I became, I've been in practice 20 years now, and the last 10 years we've really spent on trying to create the perfect culture of a research institute and a philanthropic institute, and a place where even holistic practices are not simply frowned upon for lack of evidence, but actually looked into with diligence.
And that's the Institute of Neuro Innovation that you're speaking
Correct.
of. Right. Yeah, super interesting story. And, I found it quite inspirational how you talked about your dad on your website as well, and how that kind of impacted your thought process.
You're absolutely right. I mean, the impetus, the actual charge to do this, it was always in the background as somebody going through the journey of neurosurgery, but it wasn't until I saw my father unravel in front of me that I really was like, okay, so we are exactly what our brain tells us we are. If our brain does not simulate our reality on a daily basis, we completely unravel from within. And so that's what I saw firsthand with Alzheimer's disease. And that was the drive for me to accelerate my sort of philosophical, passionate interest in these subjects, to actually saying, I'm a neurosurgeon that looks at these pathways on a daily basis, and I cannot help someone with Alzheimer's disease by restoring the function of their white matter tracts, by getting rid of their amyloid plaques, by reconnecting what's been lost. And that was the impetus to really say, okay, we need to look at this problem at the molecular level, at the subatomic level, and at the grand societal level, because it really crosses all those realms, all those scales of existence.
It's so true. I mean, being a surgeon myself, and I feel your pain because you just feel so helpless in those situations where, you can't just remove a tumor and Alzheimer goes away. It doesn't work that way. It really is a combination of all those things you're talking about, the way you've lived your life, even your sleep, your exercise, your spirituality, your personal connections, your low levels of loneliness that all come together to form this problem. Like, the neurosurgeon, I mean, you were considered, like, there's that joke, this is not neurosurgery. Like, neurosurgery is the most complicated thing you could do, but you're still helpless in those times. And I felt that as a surgeon myself, and that's really what got me interested, taking a big step back into the philosophy of life and just health in general. And it's, I feel you. We're like, we're brothers from a different mother, I think, in our
Wholeheartedly agree.
Yeah, absolutely. So let me ask you, because this is such a, huge topic for me, is when I'll tell you a little bit of my story. About 10 years ago, being a stressed out, overworked surgeon, working 7 days a week, sleeping 3 or 4 hours a night, I started losing my cognitive function. And to me, huge alarms were going off. I need to change my life. And I'd love to hear your perspective on how the things we do in our even 20s, 30s affect our long-term brain health, and kind of what we can do to reverse that process. Because when I look around, I see 90% of people not taking care of their brains in their 20s and 30s. Could you talk about that? Let's just start at the beginning a little bit, if you don't mind.
I mean, I think that's a fantastic way of putting the whole thing together. I don't think I've looked at it that deeply. I've, maybe being a surgeon, I always want to, I want the person that I meet to improve as a result of my services or our interaction. I've never looked at someone, as a longitudinal subject, having undergone different practices, maybe having had bouts of drugs and alcohol or other substances, or having depression and trauma in their life. So of course, all of those matter. But what I like to look, when I look at the nervous system in an anatomical functional way, I say the structure is undergoing the micro trauma of life, which is oxidative stress on planet Earth, and our cellular apoptosis and other mechanisms, including genetics, are at play. And then there is the macro trauma that is either brought upon by a terrible relationship, or having to go to Afghanistan, or having concussions as an athlete, or having dementia, like Alzheimer's type. And Alzheimer's was the one that was like so much more complex than saying, oh, this blow caused the Alzheimer's, or this particular event. It was so much more integrative. I've seen investigators call it diabetes type 3. Mm-hmm. So it really goes into the nature of how cellular function can affect overall brain function. But the way I look at it is, as a youth, you think you're invincible and nothing matters. You can get 2 hours of sleep, you can get 12 hours of sleep, you'll function the same. And we go through this same process in residency. It's kind of a boot camp, like being a soldier or a Marine, where our physical and our psychological health is tested to its very limit. And you're supposed to have this bravado, and certainly hardship creates resilience. We know that. And but it also is traumatic. And I always thought that what I need to do is, first and foremost, keep my mindset and my perception. I need to own that. I need to own the experience of my internal perception and my mindset, because the second that we give that up, we have lost the battle to the external forces that are traumatizing us, etc. So that's how I actually got interested in meditative sciences. not just because of, trying to feel better, but trying to maintain intactness in a way that no matter what happens as a result of micro trauma or macro trauma of life, I have built enough resilience through these practices to be able to maintain the same commitment to mindset. And I think that's the only thing that I think can maintain resilience despite the inevitable suffering and trauma that we see in life.
Wow, that's so powerful, and especially coming from a neurosurgeon. So tell me about your meditation practice. Just what do you do now?
So despite having done it for, I'd say, 3 to 5 years, I still consider myself a student of this path. I'm not a guru by any stretch of the imagination. And I have literally done it all. We actually, as part of I&I, one of our board members, Ekta Agarwal, who's also a therapist herself, puts together a monthly meditation where we actually will literally try it's a completely different meditative practice once a month, from Kundalini to praying to actually mindfulness-based stress reduction techniques to breath work. So there's a lot that we have dabbled with, but as far as what we're doing at the Brain Spa right now and what we've kind of said, okay, this is going to be our signature practice, the orthopraxy of our meditative practice is part EEG based. So we use things like there's a meditation tool called the Muse, which is a 4-channel EEG reader, something of that sort. But we're doing a little bit more complex at the Brain Spa with much more channels and much more EEG related things to see if the brain goes into a state where it's not heavily using its executive function. And that's a frontal lobe phenomenon. And then secondly, to realize the importance of breathing, especially techniques in breathing that have suggestive affirmation with it. So we have a practice where we count from 100 to 1. This actually came from a French researcher. It's been well understood for about a century that kind of suggestive self-hypnotic language can help actually have a meditative practice. So we use a 100 to 1 count where we insert certain suggestive languages that we actually came up with collaboration with this French pharmacist, scientist. And at, like, say you start from 100, which is an inhale, and you go down and exhale at 99, inhale at 98. And as you're counting at every 10 or 20 interval, you use certain suggestive affirmations. And this is a 6-week program that we put for our clients. So after 6 weeks, you'll be able to do the entire thing in 10 long breaths, which is what I do now. So I take 10 long breaths on a day where I'm going into the OR and I don't have time. And if I have time, I'll do the entire count of 100 to 1. I will do the 10 long breaths at the end. And I even do some breath holding that one of my patients, who is actually a surfer, a big wave surfer, taught me. And some of the breath holding techniques are really powerful on the autonomic nervous system. And we can delve into the human dive reflex and things of that sort. But we think that there may be an immune modulation that can happen as a result of those breathing techniques. Same as, say, intermittent fasting for the gut. So
Wow.
yeah, so I'm still at it. I try different techniques. I think deep breathing, breath work, and some sort of a mindfulness-based meditation is the basis of my practice.
That's amazing. And you mentioned the Neurovella Brain Spa, which is another facility that you've created. I want to get into that a little bit more. So tell us, what is the Brain Spa? When did you create it? I mean, I love this meditation practice you're talking to me about. I'd love to learn more about it. Would I come to Neurovella to get trained in this?
Yes, actually, yes. So you would come and our facilitator would give you some suggestions, and then you would set an intention. You would be in a zero gravity chair, and either with use of EEG mapping or virtual reality, or simply closing your eyes and having a mask, you can try to delve into this state where you get a guided tour from 100 to 1, and it's a 6-week, twice a week practice where you get better and better and better at it. And it definitely brings clarity. It brings a lot of positivity. It's worked for patients that have needed spine surgery to either delay surgery or have much better outcomes, or even have better outlook about the surgery, because we know that, for example, patient expectation is a huge factor in spine surgery. And if the surgeon and the patient can agree on an accurate success rate and accurate expectations, the overall outcome is improved. So yeah, Neurovella Brain Spa is a brainchild of mine. When I decided that as a neurosurgeon, I was not giving the entire integrative care like I mentioned before. So, after my technical job was done and the wound was healed, we were sort of done. But I felt like the patients needed more, especially chronic pain patients that just felt abandoned after we took out a disc from the spine or fixed their instability or something of that sort. I felt like, at the risk of putting them in just giving them to a doctor that may just prescribe opioid medications to them, which you and I know has caused its own, significant catastrophe.
Right.
I decided to create a place where we use these mindfulness-based stress reduction techniques to deal with chronic pain, increase parasympathetic tone, delve into things like lucid dreaming to see if that self-hypnotic techniques and lucid dreaming can actually affect the nervous system. But the bottom line is, we think all pain comes from the nervous system, and your brain creates your reality on a daily basis. And the brain spa is a place where you can come get an intense treatment in learning about your own nervous system, everything from heart rate variability to your brain map, to use of virtual reality and use of haptic multisensory stimulation on a chair that's zero gravity. All of that can be used to improve your nervous system. But ultimately, the goal of Neurovella is not to just have people all go to the brain spa, is to simply have all the tools that you need at home and being able to just maintain a lifestyle that promotes brain health. Ultimately, we're a brand that wants to promote brain health.
Wow. That sounds incredible. You said a lot of things there, and I'm so curious to dive into each and every one of them. We probably don't have time, but we need hours to dive into each one. But
I'm at your service.
I wanted to ask you about a couple of them in particular. So, you talked earlier, there's a huge gut-brain connection, the heart-gut connection, and you mentioned heart rate variability. And this is a topic of intense interest of mine right now, especially as a indicator of health. And I'd like to know how that ties into brain health, but also some of the things I'm reading about heart rate variability and how one person's heart rate variability can affect another's. Could you talk about some of the things that you know about heart rate variability, specifically around the brain?
Being a neurosurgeon, I want to make sure that you realize I'm not saying I'm a cardiac expert or anything of that sort, but I have worked with cardiologists on this. And I think the basic gist is that part of your autonomic nervous system, a huge part of your autonomic nervous system, which is our involuntary nervous system, is connected to our cardiopulmonary function. Even things like the flow of cerebrospinal fluid up and down from the brain to the spine, back to the brain, and how it functions has to do with the way your thoracic cavity, your chest cavity actually expands and contracts. So there's waves in the body, right? Like we know our vital signs are wave-like. We have the cardiac rhythm, we have the breathing rhythm, we have the cardiac rhythm itself can have multiple waveforms, including the venous waveform, which affects cerebrospinal fluid. So if you look at those things, the variability in heart rate seems to correlate with a better reflexive autonomic nervous system. Now, you can be over-reflexive in anything, but the ability of your autonomic nervous system to come back to norm after a certain stress is is a great indicator of how flexible and healthy your system is.
Got it.
So if you imagine that, you know, you're driving along and all of a sudden a truck cuts you off, you get adrenaline, your cortisol level goes up, your heart rate goes up, your blood pressure goes up. That's the response and of your autonomic nervous system to a stress. So after the truck goes away, you're supposed to come back down and listen to your tunes, and how you come back down and how your cortisol level comes back down tells us whether you're chronically stressed or you have normal or optimal autonomic reflexes. So mostly, to me, heart rate variability is one of the indicators of how reflexive or how flexible your autonomic nervous system is.
Very, very
As an
interesting
indicator
stuff.
of health.
How does someone find out their heart rate variability?
Oh, there's a few tools. There, we use actually a outsourced tool. I think it's called UMind or something, Unity Mind or something of that sort. We use something like that. But there's sophisticated tools at, you know, clinical level that are being used as well.
Really?
What I don't know about, and you mentioned something, and I'll throw that right back at you, is this concept that heart rates can affect one another. And I would be very interested in learning about that, because I know people say that, you know, the way people connect through their nervous system is more than through the five senses. And I think that's fascinating by itself. Certainly it's different to text someone than to talk to someone than to see them in person. And all of those things tell me that our nervous system is able to pick up lots of cues other than the five senses that are available to us maybe only in person. So I would throw it right back at you and say, what do you know about it?
Yeah, so I've been tracking a lot of the research on heart rate variability, and one of the main research institutes is the Heart Math Institute, and they publish a lot of studies on heart rate variability. They've been at this for over 20 years, I think, and they've done studies where if you and I are talking, and we have a heart rate variability monitor on you, and I have one on me, and we're doing this chat on, you know, Zoom right now, my heart rate variability and your heart rate variability will change either higher or lower in sync. Then if we turn off the Zoom and we talk, if we talk on the phone, it will continue to do that. Then if we turn off the phone, our heart rate variability will continue to affect each other's heart rate variability even past and be synchronized, even past that conversation. And some of this gets into quantum mechanics and is really crazy, you know, almost sounds like a bit woo-woo.
That's what it sounded like to me. I do have a little bit of reading background in that, so that's exactly what it sounds like.
Right. That's exactly it. And so some of it gets a little woo-woo, but you know, it's pretty compelling stuff that they're writing about. And I'm just, you know, like everything, I'm tracking it. I definitely think, like you, there's a lot to heart rate variability. I actually wear this Aura ring, which gives me my heart rate variability on a day-to-day basis. So I like this thing.
Wow.
It's a really powerful product to track sleep, heart rate variability.
Oh, you got to send me that.
Yeah, I will.
Send me some info. I'd love that.
Yeah, I will definitely send it to you.
I mean, that's what we love about what you've created, and the whole Next Health thing is to stay, you know, to democratize clinical grade equipment to bring health to everyone. And I think Neurovella is a perfect example of democratization of brain health to bring it to everyone.
It is so true. I mean, it's such a pet peeve of mine that there's so much good science locked up in the sick care system for a century now. Like what you're doing with Neurovella, it's awesome. You're taking the EEG machine and giving the rest of us access to this before we have, you know, a brain tumor or something. It's fantastic, right? I'd love to hear more about what do you tell. You said, you know, Neurovella is all about promoting brain health. Meditation is part of it. Heart rate variability. You know, you mentioned lucid dreaming and self-hypnosis. What are some of the other pieces of advice that you give your patients about maintaining optimal brain health? If you can go through a little laundry list of things for me.
I think the way I like to engage everyone is
Mhm.
that same again, the inevitable stresses of life, the
Right.
inevitable micro trauma of life. So how do we deal with the inevitable micro trauma of life? Mindset and resilience.
Mhm.
So if you maintain uh, a formidable amount of commitment to your mindset and its health, and your resilience, meaning your ability to deal and cope with certain scenarios, psychological, physical, uh, uh, loss of loved ones, seeing your father unravel, all of those things taught me that those two things would have to be the cornerstone. So we try to engage them by saying, let's all, I mean, we're all sort of research subjects of our own, even at
Right.
Neurovella, and we'd invite you to come in, but let's gather some data on whether certain biomarkers within a nervous system, heart rate variability, EEG markers, uh, and just things that we have access to can then be used to create a signature for us to say, this is my sort of score, like say Neurovella brain scale score. That's what we actually call it. We're working
Oh,
on it.
wow.
And
Mhm.
then imagine if that score corresponds to the way I respond to a stress or a trauma or a surgery. That would be the ultimate goal of promoting that as an indicator of brain health, or at least our system.
I love it. I love having an objective measurement. And you can't really find a great objective measurement of overall brain health. So that's great that you're coming up with a Neurovella score. And then
Right.
you're saying people can get treatments and do certain things, and over time they can watch their score change or improve.
Right.
Oh, that is amazing. So do you tie in things like nutrition, sleep? Are you adding those to the mix as well?
We have, but only at the advice level right now. And
Right.
we're actually working on a prototype that tracks sleep, or at least gets sleep data from other apps that track sleep, just sort of
Right.
a cross-platform compatibility there. Because as you know, I mean, sleep hygiene is huge. And the way we go to sleep, what happens during sleep, whether we get these perfect cycles of REM, like Dr. Deepak Chopra's partner, Rudy Tanzi, calls
Yeah.
it rinse cycles
Yeah.
of the brain. So we need a couple of rinse cycles per night, and maybe even one per day. And the more you get, the fresher your brain feels, and better it can deal with memory, which is
Right.
it's our ultimate thing is to how to weave the tapestry of memory and keep it healthy and keep it
Right.
accurate.
Right, right. And I was going to ask you about that because I would say, I see hundreds of people at Next Health on a monthly basis, and brain health is always a huge concern of theirs, especially as someone hits, I would say 40 is the magic age where people start really getting concerned of it because you physically feel your brain acting differently. I don't want to say slowing down, but it's acting differently. And the two or three things that really affect people or people are concerned about is memory, attention, and depression, right? Those are all three of those interrelated, or you treat each one of those as separate individual problems with its own treatment pathway? Or what are your thoughts around those?
Yeah, I do not separate them. I know
Right,
there's subspecialists that do separate them, but that
right,
was one of the goals of Neurovella, is to say a little bit at the surface and let the clinicians do, there's like experts in demyelination, they're experts
mm,
in dementia, they're experts in movement disorders. We're not neurologists. We just want
right,
to promote a lifestyle of brain health. And I do think, and we didn't talk about nutrition yet, but it's paramount that we look at the Pentad of Health that we call in Neurovella
yeah,
is mindset or mental state, then activity state or exercise, then nutrition, then sleep, and then how you deal with whatever your problem is. Is it a medical problem? Is it pain? And what is the multimodal a therapy that you're under for treatment of that problem? If we deal with those five things, I think we can make you better as time goes on.
yeah. That sounds like an awesome kind of framework to work under. And then, I really want to talk about mindset. You mentioned that a couple of times.
Yes.
How do the people listening to this define mindset and work on creating an optimal mindset? What does that mean to you?
I mean, I think it's so we have we put them through an experience we call the Octave. There are 8 experiences, and it starts with something as basic as non-judgmental awareness. So first, non-judgmental awareness. Then we move into things like metacognition. Can you actually train your thoughts to think about your thoughts? I mean, we do that often, almost automatically, but can you do it systemically so you're not the victim of your thoughts? You're just observing them to see if they're mostly negative, mostly positive. Are they of service to you? Are they not of service to you? And then you create insight. And when you create insight into someone's story, if you're really trying to get better, you're going to be very honest with yourself about that story. And as you examine your life, your trauma points, your pain points, your weaknesses, etc., then you say, okay, these things are of service to me, and these other things are not of service to me. And I think, sorry, we're getting a phone call over here. Okay. I think that's setting an intention is probably the most puzzling and the most crucial part of what Neurovelo wants to research in and practice and promote. So mindset comes from a combination of willpower, commitment to your health, and realizing that we're all here for a millisecond in a cosmic sense, and we're sharing this and we're filtering random energies, and the best way to filter those random energies well and optimally is through our nervous system. So we have a little bit of a causal influence through intention into whether we can have a decent experience during our little microcosm here, or whether we're going to be the victims of the inevitable suffering that are occurring all around us. And Neurovelo wants to tap into that and say, no matter what your circumstance is, you're going to be a little better when you leave our place or our method, because you're now holding the joystick, you're now holding the remote control of your nervous system by actually letting go of a lot of other control and defense mechanisms and whatever else had you be a victim of your own beliefs. So disbelieving is the hardest thing in the nervous system, and Neurovelo wants to put a key under there and just mess with it to unlock that a little bit for promotion of health.
Wow. I mean, this sounds like you guys have really put together an incredible program here. I can't wait to visit and experience. Are you so you're in Santa Monica with Neurovelo right now? Are you looking at expanding into other areas? And fantastic. And how does
1 second?
So how does someone who doesn't have access or doesn't live in Los Angeles access some of your teachings? Because it sounds like, sounds like you guys need to write a book.
Well, believe it or not, we're in the process of that as well. But basically, I think, we do some virtual consultations. We even have a virtual reality module through, and if you get an Oculus Go, you can meet with a Neurovelo facilitator in an outer world. Wow. And so we're doing a lot of things to try to promote this. We're still relatively small. We would consider ourselves an incubator, but hopefully with your help and our greater collaborative, we can actually reach a much larger audience. But neurovelo.com or inifoundation.org, both connect to us, and we're extremely excited about what the next decade of this kind of neurocentric evolution is going to come. And I mean, even this horrible pandemic that's occurring to humanity right now is a great impetus on us really realizing what is important to us in our life and how we want to proceed with the rest of our journey.
Yeah, it's so true. I have those internal conversations every day right now, and I think a lot of good is going to come out of this crazy situation as far as mindset goes. So,
Yes.
hey, I know, Dr. Vokshoor, you have been so gracious to give us your time. You're actually in between surgery, which is just fantastic. I look forward to talking to you a lot more. I feel like we should do another episode as well to talk about a few other things, if you're okay with
I really
that.
look forward to that. I think we just kind of did surface nicks on many very important subjects, and I really appreciate you, Dr. Shah, for putting this together, and I really look forward to keeping this collaboration and this conversation going.
Yes, we will for sure. And I'm looking forward to visiting Neurovella and meeting you again over there as well. You can show me around a little bit. And how do people find you other than neurovella.com? How do people get to know you better? Do you have an Instagram or do you have a social media?
I'm everywhere at Dr. Vokshoor, at DrVokshoor on Facebook,
Perfect.
Instagram, Twitter.
Great. And we'll link on our webpage too to your on this podcast to all of your different endeavors. Thank you, Dr. Vokshoor. It was such a pleasure talking to you. And we'll
Thank you so much, Dr. Shah. Be well. Bye-bye.